Hi everybody, I'm Courtney from Kids in Motion. I'm an occupational therapist and feeding therapist. I wanted to share some tips for feeding in the first year. Two of the most common questions I get as a feeding therapist are, when should I start solids with my baby? And or my child is not doing well with that puree to solids transition. What are some things I can do? So when should we start solids with our little ones? Instead of just saying sort of a blunt between 4 and 6 months, the things we want to see are the birth weight has doubled. They can sit with like moderate support. They tend to move their head away from or toward food, kind of telling you when they're full, when they're hungry. And that extrusion reflex, or the that tongue thrust, so that their tongue is constantly kind of coming out of their mouth, that kind of thing is starting to subside. And then we're starting to get that lateralization, or the tongue is starting to move side to side in the mouth. So when the child takes a bite of food, it's in the center of the tongue and they're able to move the food over to their cheek. Those are the guidelines for when to start those small pieces of solids. For the next question, so you're starting to introduce solids, maybe small pieces of toast, small pieces of pancake, chunks of avocado, and your child's spitting them out, they're gagging, or maybe even choking. Some things you can do to help increase that jaw stability, so that munching and that jaw strength, or the tongue lateralization, or moving tongue side to side, are right about 6 months to introduce things like, he's eating something else right now, but things like celery stalks or thickly cut carrot sticks. So when a child is eating these, or kind of not eating them, but we would just want them munching on them, he will typically, can you show them? Can you try it? He will typically chew on it at the side, and he does not have any teeth over here. He's only got his teeth in the front. He usually likes it. So they're kind of gnawing on it at the side, which is going to build that jaw stability. And then also that tongue will typically follow the stimulus, or the carrot, or the celery stalk. So that's going to build that his ability for his tongue to move side to side also. I would recommend, obviously you're going to be right there if you choose to give this to your little one. And when they start to get those 1-year molars, those first molars, we're going to pull these away. We don't want them getting little pieces off. If you're not comfortable going that route, you can try these little net feeders. Do you want it? We shouldn't have given you that puff, huh? Here, can I do that? So the net feeder is going to do a similar thing. He's able to kind of gnaw on this, and right now I have frozen blueberries in there, but some kids don't tolerate, very cold things. So you could even put the carrot and the celery stalks in there, and if they're still not tolerating it, you could dip it in their favorite purees to make it more enticing for them. So he can kind of gnaw on this too and break down the frozen blueberries, and he's only going to get little particles of it, so there's no choking hazard here. Another benefit of giving them these strips of food is sort of neutralizing or normalizing that gag reflex. So a lot of our kiddos have a hypersensitive gag reflex, and something will touch the center of their tongue and they're gagging. So this is a good way to help desensitize that a little bit. If these recommendations don't work after you've been trying them for 3 to 4 weeks, then that's when I would call the clinic and do a free screening, or go forward with that evaluation. Obviously, it's best to catch these feeding difficulties within the first year. Thanks, Harrison. You've been a great model. So that's it for today. Thanks for watching. We'll see you next time. If you're interested in learning more about feeding difficulties, picky eating, the causes, and possible treatment, register and join us Thursday, the 11th at 6 p.m. for a virtual presentation. Thanks for tuning in, and we'll see you guys soon.